This is lab assignment number 4, assessment of the abdomen.
My name is Jeffrey Williams, and I consent to be recorded for this class.
My name is Madison Williams, and I consent to be recorded for this class. Our therapy dog, Harley, is present during this examination. First, we will begin by inspecting the abdomen. We will examine the abdomen from the top location. We will look with a pen light and shine the flashlight at different angles to view any shadows, to reveal any lesions or masses or bulges. During that time, we will be examining the symmetry of the abdomen. We will be looking at the umbilicus presentation. We'll be looking for scars and also for the skin to see if it is smooth and any striae are present. We will then be looking at the abdomen from the side profile view. We will be looking to see if it is rounded, concaved, or what profile it presents as. We will then be looking at the pulsation and movement in the abdomen area. We'll be noting any aortic movements in the epigastric area, as well as the respiratory rise and fall in the abdomen. We'll be looking for hair distribution, as well as the demeanor and relaxation of the abdomen itself. Next, we'll be auscultating the abdomen area. We'll listen for up to 5 minutes if there are little to no bowel sounds present, and we'll be noting the frequency, we'll be noting the character and the pitch of the bowel sounds in each quadrant. First, we will start in the right lower quadrant. Then we will move to the right upper quadrant, lightly placing our stethoscope in each quadrant so that we do not stimulate any extra bowel sounds. We will note any borgamous bowel sounds, hyperactive or hypoactive bowel sounds. Next, we will be listening to vascular sounds. First, with a little bit firmer pressure, we'll be listening for the femoral artery, noting any bruit present. Then we will move to the iliac artery, then to the renal artery, the aortic artery, renal artery, right side, iliac artery, and femoral artery as well. Next, we will move to percussion. We will be percussing in all 4 quadrants, listening for dullness and tympany in each quadrant. We will move in a clockwise location. Next, we will be percussing to find the height of the liver. We will begin by having our patient put their hands down to their side, and then we will be percussing in the right midclavicular margin lines. We will be listening for when it changed from tympany to dullness. Then we will measure the distance between the 2 lines. Typically, the top begins at the 5th intercostal space. Another test that we can do to measure the liver size is to put our stethoscopes on a xiphoid process and then do the scratch test by taking 2 fingers in the right lower quadrant, and then scratching up parallel to the border, and finding when the sound changes. Next, I'll be performing the fluid wave test. This test will test for ascites to see if there is any free-flowing fluid in the abdomen. Typically, I would be located on the patient's right side, but for demonstration purposes, in this lovely hospital environment, I'll be putting my one hand on the patient's flank, the patient's hand is pressed firmly on their umbilicus with their ulnar edge. They're pressing firmly to stop any fluid from flowing from one side to another. Then I'll take my side of my hand and strike with pressure on my other side, strike firmly on this side, and watch to see if fluid moves across. The next test to evaluate for ascites is the shifting dullness test. Since ascites often rests when a patient is in the supine position on their flanks toward their sides, you can begin by percussing from the center down to the sides and hearing it change from tympany to dullness as you get further away from their umbilicus. Next, we will be using palpation to assess the abdomen area. We will move in a clockwise formation and remembering our anatomy as we go. We'll begin by starting with light palpation. Make sure that your hands are warmed and your fingernails are short, and you only palpate about 1 centimeter in for light palpation. Using light circular motions, we will be assessing the patient for any voluntary or involuntary guarding, any pain, grimacing, or any change in demeanor. Then, next, we will move to deeper palpation. This palpation will be approximately 5 to 8 centimeters deep. Just like with light palpation, deep palpation will use 4 fingers. If you had an obese patient, you would use the bimanual method, which would include 2 hands to get past the obstructions and rigidity. Note any lumps, masses, or tenderness. If we do come across a mass while palpating, we will note the location, size, shape, mobility, tenderness, any pulse, movement, as well as the consistency, whether the mass is hard or soft. An assessment technique to locate and feel the liver is to place your left hand underneath the person's back to support the abdomen area, and taking your right hand and asking the patient to breathe slowly. We're going to be pushing in the right upper quadrant and asking the patient to take deep inhalations and exhalations. We'll be feeling for any rigid or firm masses, which would indicate the liver's edge. With each breath, we move 1 to 2 centimeters. Just like with the liver, where it is not often palpable, the spleen also presents the same way. With this assessment, we'll be doing almost the reverse of the spleen palpation. We'll be taking our right hand and placing it underneath of the patient's abdomen near the 11th or 12th intercostal space toward the back, and taking our left hand and firmly placing it on the patient's left upper quadrant, asking the patient to breathe deeply and doing deep palpation. We'll be feeling if the spleen is enlarged. Next, we'll be palpating for the kidney. We will be using the assessment technique that includes using a duckbill position of your hands to assess the right kidney. Since this patient is on the opposite side, we will be assessing the left kidney, which often is not palpable as well, not as easily palpable as well. For this, we will be placing our right hand on the patient's abdomen on the side, and then firmly palpating, asking the patient to exhale deeply. We will be assessing for any round masses. Next, we'll be palpating for the aorta's pulsation. We'll begin by taking our opposing fingers, and we will be placing it slightly to the left of the midline. We'll be feeling for any enlargement and pulsation. If any abdominal pain is cited during any of these assessments, you can move on by using the Murphy's test as well as the rebound tenderness test to find any gallbladder, liver, and abdominal pain. For the rebound test, we will be putting our hand at a 90-degree angle toward the abdomen, and we will be quickly palpating deeply and then removing it. This will show any structures that are indented by palpation to rebound suddenly and quickly. This concludes lab assignment number 4, assessment of the abdomen. Thanks
Thank you for watching. Say bye-bye.
Bye-bye. It's playing hard to get.